April is Oral Head and Neck Cancer Awareness Month, and Vidant Health has a free head and neck screening coming up this Saturday, April 21st. It's part of Vidant's prevention work, and it's taking place at Vidant Cancer Care at the Eddie and Joe Allison Smith Tower in Greenville. And Billy and I were just talking about before our next two guests came on how important that new facility is, what it now means to Vidant, and really what it means not just to Greenville and Pitt County, but the eastern region as a whole. It's certainly a much-needed facility, and the resources that it provides are going to be top-notch moving forward. We have with us here today Nikki Hyatt and Janet Reimer, and Nikki is the outreach coordinator for Vidant Cancer Care, and Janet is the oncology nurse navigator for Vidant Cancer Care. Ladies, good seeing you both. Thanks for being here.
Thank you. Thank you for having us.
Happy to be here.
We'll begin with you, Nikki. Let's start with you. Tell us a little more about your role as an outreach coordinator.
Sure. Outreach coordinator. So I really focus on prevention and early detection of cancer. So doing free screenings for the community for people who can't afford them, really educating people through churches, businesses about how to prevent cancer and how to find it early.
How long have you been with Vidant now?
2.5 years.
Okay.
Yep.
So you're still not new, but you're still somewhat fresh, I guess you could say.
Yes.
And Janet, you're an oncology nurse navigator for Vidant Cancer Care. Talk to us about your role and what that actually entails.
Yeah, sure. So I'm a part of a multidisciplinary team, and it's a role in nursing that sort of evolved and specialized in oncology care. And what we do is we sort of be that person that sort of holds it all together and steps back and looks at what's going on, the plan of care, access to care, barriers to care, tries to identify those and put resources together and sort of keep people on track so that we can move from that abnormal finding to diagnosis to treatment in the most timely way, and sort of coordinating things because there's a lot of specialties that are involved in the care of head and neck cancer. You have your ear, nose, and throat surgeons, you have medical oncologists, radiation oncologists, nutrition plays a big role, so just trying to piece all that together. And then at the end of the day, just sort of be a support to the patient and the family, and just sort of be that extra family member that kind of helps them through that journey.
And why you guys are here is to discuss an event coming up on Saturday, April 21st. And as we mentioned, April is Oral Head and Neck Cancer Awareness Month, and Vidant has a free head and neck screening coming up on Saturday. And before, again, we go into this event more specifically, when you think about cancer and the kinds of cancer, Billy and I were talking, I think about the most common types of cancer. And these may be some, but you think about lung cancer, of course, breast cancer, colon cancer. I don't think people really think much about head cancer or neck cancer. And I guess, and I'm asking you guys, I'm no expert on this, but you can really get cancer anywhere in the body, right? I mean, I guess it's just something you don't think about when you think about oral head and neck cancer. So prevention and awareness about this is certainly important. Let's talk about this event coming up on Saturday. What can people expect, and why is this event important, Nikki?
Sure. So people can expect it's probably a 10-minute exam. It's very quick. People who are going to their dentist regularly, they may have noticed their dentist feeling around their neck and really inspecting and looking in their mouth. But what we're doing is having providers come out, whether they're ENT physicians or dentists, and they're going to be volunteering their time to screen people. So what they will do is look inside your mouth and look for any suspicious lesions, and feel around on your glands and make sure they're not detecting any cancer. And the people that really need to come and really are at higher risk are those who use tobacco and alcohol, because those harmful chemicals constantly going in your mouth, they really put you in an increased risk. And even using those two together, if you're an alcohol and tobacco user, then you're really at a higher risk for head and neck cancer.
Again, and this event is open to anyone that wants to come out.
Correct.
Saturday, April 21st. What time does this event take place?
It's from 8 to noon.
8 to noon, okay. Mm-hmm. And how can people register for the event?
So people can register by going to www.vidanthealth.com/events, or they can call 1-855-MY-VIDANT. They'll pick a time that they want to come, so it's not standing around waiting in line. We actually have appointments for people, and they'll just show up. We will take walk-ins that day, but we prefer that people register ahead of time. And we have plenty of spots open. We're glad to take anybody in. We will also have some things that day for further awareness. We'll have some smoking cessation, things about how to quit smoking, what smoking does to your health, specifically for head and neck cancer. And we'll have information as well on alcohol use, how that plays into head and neck cancer. So we'll have some educational things as well that day.
Janet, speak of the importance of prevention and what kinds of resources Vidant offers.
So, yeah, this is one of those cancers that really, there are factors that you can control and obviously some factors that you can't control, but really lifestyle choices are a big piece of it. The smoking, the heavy alcohol consumption, the combination of the two. Something that we don't think about a lot too is sun exposure. Here in North Carolina, we are out. A lot of our jobs will put us out in the sun. So protecting ourselves, you can get a lot of skin cancers and things and lesions around there from that sun exposure. So. The early awareness, the lifestyle choices, this is a cancer that certainly if we find it early on, the outcomes are much better. So we're just trying to really, raise that awareness because you did say it's not a cancer that people think of, and it's not a cancer I think people really want to think about. But we really are trying to sort of get the message out there that, if you're aware of what the risks are, if you try and kind of keep up with some sort of routine care with primary care or a dentist, and if you notice some things, mostly that may mimic other things, sore throats, something, a sore in your mouth that doesn't heal, a lump in your neck that doesn't go away, those are common things that could mean a lot of things, but if there are things that persist for a greater than maybe about 2 weeks, you should really seek medical attention. We want to get that message out as well. And if you are a smoker or a drinker, and you do notice these changes, this is something where we want to get that message out that you probably really need to go and get evaluated.
Nikki Hyde and Janet Reimer joining us here on our Vidant Spotlight. Again, April is Oral Head and Neck Cancer Awareness Month, and this event is coming up on Saturday, April 21st. It's a free head and neck screening from 8 to 12, and you can register again online. What was that site again, Nikki? VidantHealth.com/events or 855-MY-VIDANT. And I pulled this stat earlier before you guys come on, and it was staggering to me to see this, that oral cancer awareness in the country or amongst the American public is very low. And it said that approximately 49,750 people in the U.S. will be newly diagnosed with oral cancer this year, which is, again, a staggering number to me, and 132 new people in the U.S. every day will be diagnosed with an oral cancer. So prevention, raising awareness is absolutely important for you guys to continue to do, which is what you're doing a great job of. But it's important for people to know because it also said that one person every hour of the day will die from oral cancer. When you think about it, that really puts things in perspective, doesn't it?
Correct.
It sure does.
Yes.
So again, it's just one more cancer that you hate to have to think about, but it's a part of life, and we're glad that Vidant offers these kinds of free screens. And I guess you guys offer, now, is this the only event taking place for this particular kinds of cancer or this screening for the year? Or are there others coming up moving forward?
So there aren't others coming up. We did one last weekend at the Lucille Gorham Intergenerational Center, and that one went well. We screened about 37 people, and we found several, actually, people who used snuff that have used it for almost their entire life. We found some lesions and things, so I will be calling those people this week to follow up and just make sure they're getting the care that they need. So we found several abnormal findings there. So we did that one, and then we'll do another one. But we try to do screenings throughout the year. I'm planning one now for breast cancer within the next few months. We usually do a skin cancer one in the summer, so we're looking to see how we can plan that. We really want our new tower to be, we don't want people to just see the new tower as you come there when you have cancer for treatment. We want to people to see it as I can come there and get information about how to prevent cancer, and get screenings and things like that. So we really want people to see that we're trying to be proactive about cancer.
And be more specific with the actual event on Saturday. Where in the Eddie and Joe Allison Smith Tower will this take place?
Yes, this will be in the back of the building.
Okay.
There's a awning with a door underneath in the back of the building. We have special parking there reserved just for the screening. We'll have event signs I'll also be, if you register pretty soon, within the next couple of days, I'll be sending out an email of where to park and things like that. So it's actually in one of our clinics, Clinic D.
Okay.
But we'll have volunteers there. We're partnering with the ECU Dental School and also with Eastern Carolina ENT. So we've all been involved in the planning, and we'll be sending out some information about where that'll be.
So a lot of good partnerships taking
Yeah,
place
yeah.
with VITA and other entities to put this event on. And again, it's a free head and neck screening coming up this Saturday. What did I miss that you guys would like to talk about and let our listeners know? Either one, Janet or Nikki.
One thing that we didn't touch on, too, that we want to make people aware of is that there's a subset of head and neck cancers as well in non-smokers that's driven by virus, the HPV virus. So that's another piece that we want to educate the community in and talk about vaccination. I mean, if you're at the age to get vaccinated or you have children, that's an important thing because we are seeing these cancers that are related to that. So one thing that we definitely wanted to kind of get out there as well, that we're going to have more information about at the screening to share with the community.
And I when you think cancer, I guess you shouldn't put cancer, that disease, into a certain age bracket. It really can affect anyone, right? Children, women, men, adults of all ages, right?
Correct. Yeah. Most cancers can affect anyone. A lot of cancers, this cancer, lung cancer, colorectal, are in the older population. So we won't really be screening kids that day. They can bring kids. We'll have some stuff for them to do and some things for them, but we won't really be screening kids because this is more of a cancer for the older population.
Again, it's Saturday, April 21st from 8 to 12 at the Invited Cancer Care at the Eddie and Joe Allison Smith Tower, Clinic D, I believe is what Nikki
Correct.
said. On Saturday, it's free, so you have no reason why you shouldn't go out and take part in this screening coming up on Saturday. Nikki Hyatt, the Outreach Coordinator for Invited Cancer Care, and Janet Reimer, the Oncology Nurse Navigator for Invited Cancer Care. Thank you both for what you do and for being on with me today. I really appreciate your time.
Thank you.
Thank
And I
you.
hope that you have a good turnout for Saturday.
Yeah,
It's
awesome.
a really good deal what you
appreciate
guys doing, so we appreciate that.